Excellent. Hello, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified about 30 or 40 times on the screen. And the camera's coming in from the back. This blue cannula is coming in from the front. Just to the right of that's going to be your biceps tendon. It's hard to see because of some of this torn tissue, which is what we expected to find from the imaging that we have. We've got the shaver coming in now. We're just going to use this shaver to debride a lot of this so we can really see what's going on here. Can't quite see if this is cuff or what yet. And now just that quickly we're getting a little bit of a better look. We'll look down here. We can see a lot of articular, lift up on the shoulder just gently. We're seeing a lot of articular cartilage injury on the humeral head. See at the top of the screen there? This all showed up on the MRI scan. We're going to rotate the camera so we're looking at the inferior part of the joint down here. And we can see basically a loose piece of cartilage there coming off the humeral head again. So just rotate a little bit. We'll go ahead and turn the suction on. If we can't get to it from this angle, we'll switch. But that obviously is not going to stay. There's some suture material down below here. We'll take a pair of scissors and we'll get out as much of that as we can, anything that's visible. So again, the most remarkable finding so far is this injury to the cartilage on the humeral head here. We'll show you some more in just a little bit. Okay, what we're doing here is trying to pull out some of these old sutures since they're not doing anything functional anymore. Hold that up there somewhere. And we're just taking our time, seeing what we can retrieve here. Got a little piece of one there. We're going to keep working here. I just wanted to show you what we were working on. This is down at the bottom of the shoulder. There's a little more. I'll show you some more in a little bit. Okay, so this is the anterior shoulder. And obviously you've got a lot of degenerative change. I think the last thing you need is something or a procedure to tighten the shoulder up. All the suture that was exposed has been removed. You've still got some fraying and relatively loose tissue here, but your shoulder was not unstable under examination. So that would tend to indicate that the loss of cartilage and the stiffness from the degenerative change is what's driving your clinical symptoms here. Now we're going to rotate the camera. We're going to look up here. I don't see a significant tear in the rotator cuff. We do see that your biceps tendon is pretty much covered up by scar tissue here, because there's the tendon right there. We can even sneak behind the tendon like this. But right now it doesn't look like the rotator cuff is torn. And the tendon, at least in this part of the shoulder, the biceps looks okay, other than the scar tissue that's kind of encasing it. There's a better shot of it there. We sometimes see a normal variant with the biceps where there is a sheath around it inside the joint, so I'm not sure that this is completely a reaction to prior surgery, and part of it just the way you're built, because here's the rotator cuff behind it now that we've released that a little bit. Okay, so at least now it looks like a biceps. You can see it there. I'm going to go off on the video. We've still got to deal with some of the cartilage that's loose in the back of the shoulder. Okay, so now we've switched positions. The camera's in the front. This blue cannula is coming in the back. We're going to back it out just a little bit so you have a little more space to work. But you can see the cartilage. Turn off the outflow on the cannula. Yeah, you can see the other way. 90 degrees. Perfect. You can see the cartilage damage here. And then lift up on the shoulder a little bit. And then you can see some of these areas that were probably read as loose bodies where the cartilage is just loose and flapping down. I don't want to remove anything normal, but I don't want to leave anything that's going to be symptomatic. So go ahead and lift up again. Yeah. That's great, just like that. Okay, so I don't see any of those flaps anymore. We've got this injury in the front, but again, instability hasn't been your issue and wasn't your issue even under anesthesia, so I'm inclined to leave that alone at this point. I don't see any loose cartilage or anchors or anything else like that to worry about. Okay. We're going to rotate and look up at the posterior aspect of the rotator cuff here. You can let go of the shoulder. And this looks fine so far. You can even maybe sneak around the biceps tendon like that. And then look down the front. And that's all we're seeing there. So I don't think there's much else to do inside the joint. Your biceps isn't torn, it just was scarred down and we've released that part of it. And we'll get out whatever's remaining of this suture material, and then we'll show you some more in a little bit. Okay, so we're up in the subacromial space. We're looking down on the rotator cuff tendon now. I've spent a fair amount of time taking away a bunch of scar tissue up here, so this probably had something to do with your symptoms also. And now as we just look towards the front of the shoulder, we can see that the rotator cuff in the front looks fine. We've released the coracoacromial ligament here to give you a little more space. It was pretty robust here and impinging. As we rotate the arm, we'll look at the rotator cuff move. And there it is here. And I don't see any defects in the rotator cuff tendon, so that's a good sign. So I think we're just going to have to figure out how to best manage this arthritis for you, because you're awful young to have to sort out a medication routine, and we want you to be active, but we want to be smart about protecting your shoulder going forward. So I'm going to do a little bit more debridement here, maybe remove a little bit of bone, but otherwise we're going to be getting you back to the recovery room in just a few minutes, okay? So I really hope this does the trick for you. Good luck to you now. Bye-bye.